Italian horse.
I've got the mags up there.
Not yet, they don't look it over. Break ground.
Thank you for coming and helping us.
My primary care doctor is at that.
When in March, I think.
What makes you say, oh boy?
We got, she wants me to record the speed, so I don't know how, I got 2 mics. I saw oh, yeah. We want the, this should easily last more than 2 hours. It should, but continuous play. Oh, no. Yeah, how much?
you just get music?
Yeah, he was like, well, that was a good little group. You guys still do that?
You told me so. Another group.
Yeah. I don't know if I should invite him to that either because that's,
Yeah.
I told you he's related to me. Yeah, I do it on Sunday. No, English is not your mom.
Thank you for listening.
They're getting help from forces from Kenya.
Keep saying people.
Yeah, I wouldn't recommend it over there because there was a missionary who was killed.
That would be
That
good.
was such a hard reference.
That good. I still have plenty of battery left.
Wow, you must have a good battery in
That's
there.
really good. Let's go get the other mic.
Want me to grab the one from here?
Not the whole country, but it's
It is what it is.
that's
No, he went to Julie's.
oh, you are?
Well, I'm hoping this works.
Yeah. Well, that's a great idea.
He would have
At least you're.
Thursday night. Yeah.
And they link
had
to your
our
phone?
delays up
Yes.
on the lake
And then you can
playing
record
the-
from that?
Yes, and that way I don't hear no background noise.
Wow, that's pretty professional.
Let's see if it works.
rough, but
Let's see if it works.
Doyle's got all the cool toys.
He does.
Yeah, they're only $19.95 on
Hey,
Amazon.
I'm thankful.
Let's see if it works. Let's see if it hurt. You can hear it. Hey, John. How are you? Good, man. How you been? How's Florida? Oh, come on. There you go. I heard something. Yeah.
Building Noah's Ark.
Wow, sounds great.
Sounds really good.
See, I pulled the mic over here.
Nicole is dehydrated.
She don't have the money because she's got a money.
You don't need it, Mike. Let it go, girl.
Well, good morning, everyone.
Good morning.
Somebody's tired, I guess. Welcome to our health fair. We are delighted to have everyone here today. I hope more folks show up to enjoy everything that we have to offer today. My name is Patty Dimitriev, and I will be your hostess for today. If you've got a problem, you let me know. I'll try and fix it or get after the person who caused the problem. All right? I hope you enjoyed the live band today. I know I certainly did. If you guys need any water, we have it over by the door. Today's program is sponsored by Health for Life, a health ministry of the Burnsville Seventh-day Adventist Church. And it is our pleasure today to welcome and to bring as our guest speaker Dr. Philip Collins. Dr. Collins is a distinguished specialist in preventative health care. Dr. Collins earned his doctorate in public health from Loma Linda University and has dedicated many years to serving as the Director of Wellness and Cardiac Rehabilitation Department at Park Ridge Hospital in Fletcher, North Carolina.
Amen.
With over 44 years of experience in lifestyle behavior change, Dr. Collins brings a wealth of knowledge and expertise to our event today. Amen. Please join me in giving a warm welcome to Dr. Philip Collins.
Woo-hoo!
I hope you can hear me just fine without that. Are we good in the back?
Yes.
Great.
Woo!
I want to spend a few moments setting the stage in the area of what I call health philosophy. Because if you miss the philosophy, everything else is just a bunch of facts. So, a few things you can do. Number one, this is supposed to be a natural remedies seminar. Well, you have to conclude from the topic that if you need a remedy, there must be something wrong with you all.
Right.
Okay, so I like to start out with that at the beginning, okay? So natural remedies are things you want to learn in case of, but you want to be able to say, I don't have to use them.
Correct.
That's preventive medicine. So the first thing, and you're going to hear a lot about this, and you probably already have, is in the area of natural medicine, the big thing right now is cleansing. They want to cleanse you to death, so to speak, okay? That is the epitome of being a naturopath. A naturopath's whole focus is what can I do to improve body function? Because they believe, and I also do, that if I have normal body function, the body's smarter than I am, and I don't have to second guess or doing this or doing that or something else. And it's a very important concept, and that is that you've got God on your side because He made the food. Okay? And when God made an orange, He made it complete. Let me give you an example. Many of you are still in the milligram stage. An orange only has 60 milligrams of vitamin C. By the way, that's correct. So therefore, my doc wants me to take 1,000 milligrams of vitamin C. So how many oranges you have to eat today? But see, we missed a very important concept. It's called nutritional synergism. That orange, when you eat it, because of the chemistry that God put in it, is worth about 1,500 milligrams. But you go, wait a minute, it's only got 60 in it. I said, the antioxidant potential that God put in that fruit is so far beyond my pill that that's the first concept. We need to eat more of this. The next concept is the whole area of cleansing. So what's the best way to cleanse your skin? Besides taking a bath. Okay? Hopefully we got that one down. This is the best time of the year to cleanse your skin. So if you're out there working hard and perspiring, you are doing one of the best detoxification processes you can possibly do in your body if you hydrate. If you hydrate well, sweating actually is excellent for skin and tissue. So that's our first organ of elimination, and that is your skin. By the way, it's one of your larger organs too. The next organ of elimination is your kidneys. How are you going to take care of your kidneys? You're gonna drink enough water because the more water the kidney can process, the less workload. The workload for the kidney is concentrating the waste products. So people say, well, I don't want to wear out my kidneys and drink all this water. No, it's actually the opposite. The more water you drink, the longer your kidneys are gonna last. So we got the kidneys, we got the skin, we got 2 more to go. This is a quickie course in being a naturopath. Okay? The third organ of elimination is your liver. And right now, in the past 20 years, we're seeing an incredible upsurge of non-alcohol related liver problems. People, especially in this part of the country, have never drunk a drop of alcohol and they got severe liver problems. See, when I graduated, we could blame it on alcohol. We didn't have this problem. Now we've got a totally different issue. So, once again, how do you cleanse your liver? Well, that's what we're going to talk about today. That's nutrition. Because nutrition will either wear that liver out a lot quicker, or you'll be able to preserve it. And you want your liver to last longer than you do, I say it that way. Now, the last organ of elimination is your whole intestinal tract, all 25 feet of it. The liver takes its toxins and puts them into the small intestine. If you have enough oatmeal for breakfast, or if you've eaten your apple a day to keep the doctor away, then you have done the best thing you can do to detoxify the whole intestinal tract. So when you go to the health food store and they want to sell you this cleanse and that cleanse and 18 other cleanses, say, no, I'm going to eat right. And save yourself a lot of money and be a lot healthier. So how do you like my picture? Good. We got some good food up there. Hopefully you had a good lunch. I did. So with that in mind, we're going to spend most of our time, I'll talk for about 45 minutes, and then we'll open it up and you can ask me any question and I'll tell you whether I can answer it or not. Thomas Edison, the doctor of the future, will give no medicine, but will interest his patients in the care of the human frame, in a proper diet, and in the cause and prevention of disease. The doctor of the future, that was, I'm not sure exactly when he wrote it, but his lifespan was 1847 to 1931. Not only ahead of his time for the light bulb, but ahead of his time in his thinking. The American Heart Association has made certain recommendations. The reason I bring this up is because I want to tell you that there's a lot of information out there that is utter failure. And this is going to be a classic example here. The reason I tell you that is because I want you to do your own homework, but I want you to ask a very simple question. Does it work? Don't tell me anything else. Does it work? How many people are still alive at the end of what you're recommending? And if your recommendations are not keeping people either improving their health, then I'm concerned about you. So, American Heart Association recommendations. We have healthy individuals take 2 servings of fish, salmon, sardines, tuna, mackerel, trout, weekly, along with flaxseed, canola oil, soybean oil, and I hope you don't believe any of what I just read. Because that is, I'll show you the results in just a minute. And since it is the Heart Association, they're talking mostly about coronary arteries. When I graduated from school, it was all about decreasing heart disease. And over the past 45 years, heart disease has pretty much leveled out, in some cases come down, and cancer in some cases actually surpassed it or right there with it. So I'm going to tell you something about this slide. You see these foods right here? We thought we'd tell you, we're going to cut back on the red meat and eat white meat. Guess what we did to people? We suppressed their immune system and helped them with the cancer. See, part of science gets so tunnel vision that you can't see what's going on. We're so busy working on this that we mess up on other things. The second thing here, patients with coronary artery disease, heart disease should consume 1 gram of your essential fatty acids, your EPA or DHA, and they need to think about fish oil supplements. By the way, I'm reading this because I want to show you the outcome, not because these are my recommendations. And the third, utilize complex carbohydrates, now we're getting close, high in fiber, low in glycemic load, and reduce the risk of coronary heart disease. Now, let's see how it works out. People have to ask the right question. We've been doing this since I've been in school. Here's the slide. Here's how it's working out. results of 26% fat, and we would consider that actually a low-fat diet in America. That's the American Heart Association, by the way. And keep your cholesterol down to 250 milligrams of cholesterol a day. That's what I was trained in. So, did it work? Let's find out. Standard heart disease diet. After 4 years of being on this diet, they had a 6% decrease in total cholesterol. And obviously that 6% decrease happened to be the bad guy, so I would compliment you for that. But let's look at what happens when we do the angiography and see how the vessels are doing. After 4 years on this diet, we had a 6% regression, which means the plaque actually reduced. I have more blood flow through the vessel. I'm thankful for that 6%. 15% had no change, they were static, so the diet didn't do anything. But look at the bottom one, that's a scary one. Almost 80% of the people kept blocking up, blocking up, blocking up, blocking up. Thank you, American Heart Association. Please don't follow their diet unless you want to be with these results. Another study, looking a little bit longer range, we looked at 10 years, and oh, let's push it a little bit longer. Maybe people are going to turn around after 4 years. Well, 3 years, 41% had progression. After 5 years, 65% had progression, flat getting worse. After 7 years, 77%, and after 10 years, 85% of the people on that diet, which most Americans would consider healthy. I'm standing right in your way, aren't I? Most of the people in that group, after 10 years, 85% of them, coronary arteries getting worse, and worse, and worse, and worse. But it's okay, I'll just put a stent in. No, it's not okay, folks. This is totally unacceptable. If you want to do that, that's up to you. But there is a way to deal with it differently, and that's why we deal with natural remedies. Here's Dr. Dean Ornish, a guy out of San Francisco. He is an endocrinologist. Got a really neat history. This is his first studies. He did it on diet and heart disease, and did the showing you how he regressed flat. Then he's progressed all the way through, and you men will be interested that he did one on prostate and how this same diet reduces the prostate risk of prostate cancer. And now the third level he's on right now, which has got my attention, and hopefully it will affect some of you, especially if you're my age or older. He's showing the results from this diet on dementia. And I was going, oh no, I can't remember that, you know? So you keep progressing along, but what I want to tell you, here's a principle. The same diet, if it's a healthy diet, you don't have to worry about treating one thing and increasing something else. When you're on the right program, you treat every disease, every ailment, it's all the same thing. You're not doing something wrong. Medicine has got to shift their mind because we get so tunneled that we think, well, I'm going to improve this. I'm sorry, I hurt you over here. No, the right diet, the right program, it's 100% for all problems. Okay, back to Dean Ornish, Dr. Dean Ornish. He put people on a plant-based diet, high fiber, and got so specific because he knows human nature that he actually fed them. You go in 3 times a week, 2 or 3 times a week, and you go for your stress management class, and you get your exercise, and then you go home with a whole stack of Tupperware with your lentils, okay, or your rice, or whatever he's feeding you. He knew he couldn't take the chance. If he told people, give them a sheet of paper and said, go follow this diet, you know what happens. You know what you do with the sheets of paper. Right outside the doctor's office. After 1 year on his dietary program, 1 year now, not on statin drugs, 1 year, a 24% decrease in total cholesterol. Try that one on. And the part that decreases, the one we are concerned about, the 37% decrease in LDL. That's the bad guy. That's the one that causes your vessel wall inflammation and block you up. How about angiography? How about, can we see something going on here? This is lab work here, and that's nice, but does lab work translate into reality? So in angiography, 82% in that group, in 1 year, 82% had regression. The plaque is getting smaller. 14% no change, and 4%, so it's not 100%. but I sure like these numbers a lot better than what I just showed you. He took a look, all lesions, all blockages, 2.2% diameter overall regression. You go, wow, I did all that. I ate beans and rice for a whole year for 2.2%. Well, the physiology of the vessel, the physics of flow, whether it's a hydraulic system or your blood vessels, for every % change in diameter, you get 4 times increase of blood flow. It's simple physics. It works out in humans, works out in your backhoe. 2.2% change in regression of plaque was equivalent to 8.8% difference in blood flow. And that's the difference when a patient walks up my steps into the office, he says, "Doc, I don't hurt today." I do a lot of praying because I don't want to give people bad advice. They walk in the office and they go, "How's the angina?" He goes, man, but I don't want to go under the knife. I'm going, listen, I can tell you what to do, but you have to realize that you are very fragile. And when they walk in the office, I go, "How's it today?" You go, "I came up 6 steps and I don't feel a thing." And you go, "Thank you." That was with overall lesions. But look down here, 9% increase in flow. I said 8.8, we're good. Now the lesions that are greater than 50% blockage. By the way, doing thousands of treadmill tests, you can have a 50% blockage and walk out of my office and I'll tell you your heart looks good. A treadmill test is only good for 70% or above blockage before we can get to you. Because the body compensates that much. So see, we don't have a good external test without sticking something in you to check it out. Lesions greater than 50% blockage, we had a 5.3% regression in them. Now let's do our math here. The ones that were the bigger blockages at 5.3, multiply that times 4. I've got an increase of 20% flow in 1 year. I got a new man on my hands. And down here, 23% increase in blood flow. What I say, 29, say 25, somewhere in that area. That is absolutely phenomenal. There is nothing that I can offer you any sweeter than that. It just doesn't get better than that. And this is without bypass surgery. This is without stents. This is without, this is you going home and eating your beans and rice. Now that's what I call a natural remedy. 10 animal proteins. I realize this is in rabbits, and I know we're not rabbits, but we have a good comparison here. I wanted to show you because some people have misconceptions of where cholesterol is, and I can do this and I can do that. Remember, when I finished my training, my goal was to get you off animal fats. So I told you to drink your skim milk, and I told you to eat low-fat this and low-fat that and low-fat something else. Well, let me ask you, America, how's it worked out for you? No, it hasn't. So egg yolk protein, you expect that to be elevated. But I want to show you something about this slide. See, it says egg yolk protein. It doesn't say egg yolk cholesterol. Now in an egg, cholesterol is mostly found in the yolk and minimal to none out there in the albumin, the white portion. So when I take all the cholesterol out of that egg yolk and feed you nothing but egg yolk protein, look what it did to your body. You see, we've been harping on cholesterol so much and forgetting that protein, animal source protein, can be worse for your cholesterol than the egg, than the cholesterol in the egg. Let's go on. Here's my skim milk, the stuff that's good for you. Turkey protein, oh, the turkey, that's got to be good. Casein in general. Here's whole egg protein, not just the yolk. Fish protein, beef protein, chicken, pork. You go, why is pork doing so good? I would never touch that stuff. See, unless you've got the data, you can't make proper decisions. Now here's raw egg white, which means they got the yolk out of there. That's just almost pure albumin, pure protein. And then the average plant protein is about 67%. So if you just want to raise it, some of you know your cholesterol numbers. I realize these are rabbits, but it'll still give you some correlation between what we're talking about here. This slide is a result of a person changing and being on a vegetarian diet. So, relative change. Now, relative change means we set everybody at 0. It doesn't tell me what your number is. So if you had a 16% decrease and you were 200 here at your cholesterol level, then you would be, what, 168 there. A nice drop. And that's on a lacto-ovo-vegetarian, meaning you still consume milk and you still consume eggs. Now that's how I was raised. When I was a kid, I was really weird because I was a vegetarian. And if you don't think being weird in the 1950s, being a vegetarian, I was weird. And in fact, I almost thought something was wrong with me, okay? But when I play sports and outrun them and wrestle, they changed their mind a lot. So over here, the lacto-ovo did get some benefit over the person eating a lot of animal protein. The third group we have here is the total vegetarian, and you would call that vegan these days, or you'd call them plant-based. So however you want to name, that's what we used to call ourselves. So total vegetarian means all your protein comes from a vegetable source. They got a minus 23% in the cholesterol. So if your cholesterol, 29%. So if your cholesterol was 200, you drop it down to 142. Did you hear me again? Cholesterol from 200 to 142, and all I did is say, folks, enjoy your bananas, your grapes, your beans, your rice, anything that comes from a tree or out of the ground, etc., etc. Host of benefits from this total vegetarian diet is there's zero cholesterol. Zero. See, cholesterol is only found in animal cells. Vegetable cells, whether it's a carrot, orange, whatever, has no cholesterol and never did. So when someone tells you that your nets are high in cholesterol, just smile and say, I haven't found that to be true. Or an avocado. And sitting around a doctor's table at lunch or something, and I was telling them I was doing my patients, something go, oh, avocados are high in cholesterol. I mean, you know, these guys are ready to put some money on the table. I couldn't take their money because they obviously had misinformation. I mean, it's not going to be fair. Low saturated fat. Saturated fats are in vegetable foods. The big ones are coconut and palm oil. We call those the tropical oils. Now, unfortunately, I've been around long enough, or fortunately around long enough, that when I went to school, coconut and palm oil is something you would never use because you increase heart disease. In the last 10 years, they keep talking about coconut oil and do all this stuff. I'm going, I just have to wait till this one goes away again. I've been around the barn at least once, so I'll have to wait again. Coconut oil is a highly saturated fat. It's more saturated fat than lard. And say, oh, we gotta have coconut oil. I'm going, no, eat your walnuts. Enjoy your almonds. Have an avocado. It's high in fiber. Obviously, there's no animal protein. There's no heme iron. The reason we're concerned about heme iron, hemoglobin we're talking about here, that you find in the blood of animals is because it's highly inflammatory to the vessels. Rich in antioxidants, naturally, we gave an example of the orange. Rich in folic acid and B6, and promotes weight control. How many potatoes do you think you can eat? 10? 15 at one meal? A potato, a small potato would be 100 calories, and you can go to McDonald's and eat 1,500 calories on a couple burgers and fries, or I can give you 15 potatoes. See, I know how to feed you. And I can feed you more than what you want to talk about when you get the right food in the right place. Meat use in breast cancer. The reason we're talking about this is because I want to show you the comparison between the two. The socioeconomic group usually feels very deprived, and they think if I could only have enough money, I'd eat steak every night. Or if I could only have this, I'd eat better. Well, what we find out in developing countries is the low socioeconomic status that eat their beans and rice, we set their risk of breast cancer equal to 1. The people that live in the better houses and have steak every night, it wasn't an advantage because they need the bigger hospitals. Have you ever noticed something about various countries? The bigger the hospital tells you what? We go, oh, we got great medical care. I'm saying, you're right. Well, what if you didn't need it? The bigger the hospital, the more problem with the dietary situation. Many of you have read books on the China study. Colin Campbell started out as a high protein man. He was convinced that he could cure world hunger if he could get enough protein into people. And here's what he found out. So in the 60s and 70s, in the governments, universities, etc., they perceived that the world problem was low protein. This is where it actually started. Well, it actually started before that. And you probably may have had that worked on you when you were a kid. Where do you get your protein from? That's the most common question I get. First is, you're a vegetarian. The next question is, where do you get protein from? And I answer very simply, where's the cow get her protein from? Oh, you don't want to eat grass all day. I'm going, well, I don't eat grass, but you know, the cow would like to get loose in my garden if it had a chance, so we do okay. Went to the Philippines to do research because he was convinced that the liver cancer in the Philippines was due to low protein. If you don't get enough food in these people, they wouldn't have such a high liver cancer rate. Spent about 10 years. He tried to understand, okay, what can I do? On the coastal areas, we can get fish, and they can increase their protein. Because I don't have a way of storing it, or I don't have refrigeration, I have to deal with, I can't keep it and send it inland. So, working most of the children there, helping get as much fish, limited to coastal areas, and so then he turned the other areas and says, well, we'll grow peanuts. We can grow peanuts locally and increase that. Well, how did it work out for you, sir? Well, little problems with peanuts in a high humid, hot climate. He had to deal with another liver problem here, and that's the aflatoxin, which is actually carcinogenic because the mold will grow in the peanuts. So he had a dual problem. How much more, and how to prevent the contamination which causes liver. So he went on, he started looking around, he says, okay, what are my other options? So worldwide liver cancer rates, guess what he found out? He found that the liver cancer rate was highest in the countries with the lowest protein intake. So that was his theory. Did you read the next line? He believed it would be due to a protein deficiency. But when he got to the country and started doing the research, here's what he found. It was highest, liver cancer was highest among the wealthy families. 20% above protein intake. So he got a report from India, in a medical journal from India. People with the highest protein intake had the highest liver cancer rates, and people on the lowest protein didn't have liver cancer. So if you only read this study up here and looked at worldwide cancer rates with actually not digging into it, you'd come to the same conclusion he did. His mother-in-law died of liver cancer. So he comes back home to prove his theories and worked at Cornell University, worked in conjunction with Dr. Chen. That was the doctor from China who did the Cancer Atlas. So, I mean, China is huge. So he did what they call a Cancer Atlas, had over 500,000 participants. And what they do, they ranked every county, every district, I don't know if they have counties over there, anyway, districts, and they monitored their rates of cancer and developed this whole Cancer Atlas. Now, why would you want to do that? Well, here's the thing. It was a joint effort of the United States and Chinese government. But look at this. The only remaining place on earth that people live and die within a 50-mile radius. If you want to find out what that spot is doing, well, why is that so important? Today, where do you get your oranges from? Where do you get your bananas from? Where's the grapes you just ate from? You see, we deal with thousands of miles of difference in different soils, different nutrients, and that's why we have actually less deficiencies. When you channel something down to a very narrow area, whatever the soil is depleted in, you're much more likely to have a deficiency. So we've kind of overcome that because of our incredible transportation. I mean, you pick up your bananas from Costa Rica. You pick up your grapes from Chile. Your potatoes might even be from Idaho, if you're lucky, you know. So, 50 miles, they eat what they've grown there, and disease rates on this atlas, some areas had as much as 100 times the amount of liver cancer as another area. So what do? You go and you study those particular areas. And let's go down, published that book, The China Study, you probably heard of that. Let's go on. Here's what he found out. Back at Cornell now, he started doing this research, not on people, but on laboratory rats. So he fed laboratory rats different levels of protein. How much can a rat survive on? Well, he fed them on a 5% protein diet, which by normal standards we consider that low, but they had a very low rate of cancer growth. So these rats were already inoculated with a carcinogen that caused cancer. The laboratory rats that had on 20% had the highest rate or a high rate of cancer growth. Another study, using 2 groups of laboratory rats, they injected a high dose of a carcinogen and fed them a low protein diet, and they had a low response to the cancer. They injected a low dose of a carcinogen and fed them a high protein diet, and they developed a high rate of cancer. So wait a minute, protein's supposed to be doing all this good stuff for you. Well, let's keep going. By the way, Dr. Camel converted himself on this. He was willing to follow the evidence of what was going on. And then you go on, and his buddy Ethelstein was another guy who was a cardiovascular surgeon, and he starts going, I'm doing all these surgicals, thoracic surgery, cleaning out coronary arteries, carotids. What are we doing here? So here's Campbell's conclusion. You can see what you think of it. He said, okay, if I look at dietary protein and foci, now here, let's get this straight. What he's talking about is finding a disease or finding an abnormal growth, and this slide comes from intestinal tract. So he's saying, when do I see basically cancer of the intestinal tract at what protein levels? And so it goes, okay, I fed this group 4%, 6%, 8%, 10%, and then once it got above 10%, you can see it escalate. 12% protein at almost 20%. If you go up to 14% protein, you had 70% per pound, and this one would be over 80, 85%. So you can see why he chose 10%, but strictly that's just human logic. We find that populations around the world do really well at 8%. But even at 4% protein in the diet, we didn't get 100% success. So I can't offer you a 100% bulletproof program, but we sure can do things to improve. And the other thing too, is I'm dealing with one component here. What if I could take care of 10 different components? But we're dealing, remember, this is a protein component here. And if protein is this powerful for disease, I want to turn around. It's got to be powerful for living too. So let's take a look at different types of protein. The biology of protein. On the animal side, we have increased intake, increased disease. You'll find that around the world. High protein population, you'll find a high amount of disease. Heart disease, cancer, liver cancer, etc. It's high in saturated fat, we covered that right. It has no fiber. It is low in antioxidants and it's low in vitamins. It makes perfect sense. The animal got them. He doesn't want to share them. So if the animal eats grass or got your garden, ate your broccoli, all those antioxidants help him live, but he's not going to pass them on to you when you eat the steak. Animals don't do that. You've got to go over here and you've got to get your proteins. You've got to beat the cow to it, okay? So you increase your intake and we don't have disease. It's low in poly and monounsaturated fats. It's high in fiber, it's high in antioxidants, high in vitamins, because you got them first. I mean, does it make perfect sense if I beat the cow to the menu, I'm going to get what they get? Examples of diseases related to protein intake. Well, let me back up. Maybe I didn't set the stage correctly. Nutrition is the strongest contact you make with your environment. So when they say you are what you eat, it's just a different way of saying it. Nutrition is the strongest component for not only keeping you healthy, but also prevention of disease. Now I will admit something else. I've seen people taking more supplements than ever in the history of man in an effort to do what? Not lose more marbles and live a couple extra years. How about just wake up in the morning feeling great? So I'm not saying that we're not deteriorating, because the Bible tells me real clearly that man is wearing out. We can talk about environment, we can talk about all kinds of, but we are wearing out. I understand that. So I don't expect to live to 120. It'd be nice if I still had my collection. What about other diseases? These are all diseases that are greatly affected by protein intake. Cancers, ovarian, colon, and prostate. Well, the big ones, colon is one of the top 3 for male and female. Obviously, prostate is one of the top ones for men. Cardiovascular disease, it's still up there. But here's the good news. When we look at total numbers of cardiovascular disease, we compare from 1950 to where we are right now. Let's be fair. The numbers haven't changed that much, but I've got twice the population now. So technically, I've got half as many people being affected. So I'm not saying we're not making any progress, I'm saying I would like to make more progress. Osteoporosis, that hasn't backed off yet. And we've had ladies taking more calcium than they've ever taken in their whole life, and we're still not getting ahead. Diabetes is probably the world #1 most progressive disease right now. The numbers, I mean, you watch the charts, it's climbing and climbing and climbing. I had a gentleman talk to me today, he said, my goal is to get my A1C down, and that's exactly what your goal should be too. And if you want to get fancy and get tested, then you can know where you're at. Hypertension. Always, without exception, if you go with the top 3 drugs in America, where's my pharmacist? Anyway, if she was here, she would tell you that you always have a blood pressure medication in the top 3 meds that we take in America. It's incredible. Dementia, one we don't like to talk about, because quite frankly, we don't have, I mean, we've been working on medications for 20 years. The outcome is dismal. So maybe we're back to Dr. Dean Ornish and his research, trying to save a coronary artery. Maybe he's going to save some of the vessels in the brain and get some better oxygen up here. Maybe he's got a good point. And then 8,000 associations, that's just a good number. I don't know if that's true or not. But the point is that we're making these correlations between disease and process. This one got my attention though, because I have battled this, as any doctor always does. How do I deal with improving coronary blood flow in, obviously, the coronary arteries? If you look here, it says whole food, plant-based. So obviously, whole food, you're not eating refined food. You're going to eat your whole wheat bread, for example. Plant-based means it's all coming from a plant source. Low carb, high protein. Does that sound familiar to anybody recently? Have you heard of ketogenic? Well, Dr. Atkins was still alive when I was going through school. And we showed that his theory was incorrect at that time. And like I said, got another cycle. Now I've got all this keto. And I'm going, this is incredible. Low carb, high protein diet. I want you to look at what it does to your coronary arteries. There's enough research in to say if you are on a ketogenic diet, please reconsider. So I get a 40% increase in my group blood flow through my coronary arteries, and a 40% increase in blood flow is enough to do what you want to, basically, exercise, whatever. I get actually the opposite. I get a decrease in blood flow through the coronary arteries on that type of diet. It's not worth it. The research coming out now on the ketogenic diet shows an increase both in cancer and heart disease in people that are on that diet. Yeah, you lose weight, but there was also other ways to lose weight without doing this to yourself. Dr. Walter Longo, I like that. It's not Walter, it's Walter. So you can know where he's from. That's great. Out of UC, University of Southern California, UC Davis. He works in gerontology. This guy, if you remember that name, he's got a lot of good research out. But here's the point. Out of cell metabolism. It is known consumption of animal protein will increase insulin-like growth factor. Now, that's a fancy chemical they use, but the function of insulin-like growth factor is because it perpetuates cell growth. So this is one you keep your eye on for cancer. Now, from an animal standpoint, the animal products, milk, etc., will have a lot more IGF-1 in it than you'll find in your green beans, because there's nothing in the green beans, okay? So we see an increase in diabetes and an increase in cancer. And obviously, back to our animal protein. So eating less animal protein in the people that still eat animal protein lowers the insulin-like growth factor. So they are actually decreasing their risk. So not everybody's going to do what you, well, not everybody's telling what I tell them either. People are going to want it. So I go, wait a minute. If you look at health as a ladder, okay, my goal today is just to encourage you to take one more step. Some people go, well, you always talk about the top of the ladder. I said, no, that's where you're headed. But I want to tell you that every step you take on the ladder, you've gotten yourself in a better position. So when you leave here today and go home saying, listen, yeah, I need to spiff up, I need to improve, then take one step in the right direction. It pays big dividends. Consumption of protein in various diets. A high protein diet greater than 20% of calories, we get a 74% increase in overall mortality. Let me read that again. If you're on a high protein diet, you've got a 74% increase in dying. In this age group, 50 to 65. Some of you fall in there, you go, I think I need to think about it. But look at this one here. This one is what the research, you kind of go, wait, why are they throwing that at me? You get a 28% reduction in overall mortality if you're greater than 65. So therefore, do people over 65 need more protein than people under 65? No. Thank you. You got the right answer. I'm just telling you what the research keeps coming out. I'm saying, okay, let's keep digging in this article. Here's what we found out. The people in this group here, the over 65 age group, if they stay on the high protein diet, have a fourfold, that's 400% chance of dying from cancer, and a fivefold, that'd be 500%, if you do the percentages, of dying from diabetes. I'm sorry, I'm good. I'll stay with the guys down here. You may look at this, but if you want to choose cancer or diabetes, I think I'd just pass on both of those. Moderate protein diet, 10 to 20%, and then low protein diet is less than 10%. So keep those terms in mind as we go on with this guy's research. The relationship, now here's the encouraging part. Relationship disappeared if eating only plant proteins. So let's make the point. If you're going to eat enough soybeans, I don't have to worry about it. So there has got to be some advantage even between proteins that are from vegetables and proteins that are from animals, where you can actually, in my opinion, eat too much protein, more than what your body needs, from a plant source and still not have the negative effects to your health. Got I'll call him young, because he's younger than me, man at our church, and he is a bodybuilder. And his goal is to get in 100 plus grams of protein a day. But he's vegan. I mean, the guy eats beans and then beans for dessert. I mean, he is not, doing all this, and not too bad on the powders. You can get a lot of protein from powder. But I'm talking about, you're eating way too much protein. He goes, well, I've got this much muscle, and I'm doing this and doing that. I said, okay, we'll keep talking again. But anyway. But this is what I'll point out. You basically do not have the same negative effect if you're worried about eating your soy or your baked beans or et cetera, et cetera. The European Prospective Investigation of Cancer Nutrition Study, 38,000 people. Their goal was to discover what happens when we change. For every 5% consumption of animal protein, you get a corresponding 30% increase in diabetes. I just want to change you just a little bit today, okay? That's what this is about. Proteins that heal. Vegetable proteins, if you're going to eat protein, please get them from a vegetable source. I mean, I don't want the turkey to be smarter than me. Because watch what the turkey eats. He's not eating hamburgers and hot dogs. Now, you may want to eat him for Thanksgiving, but the turkey shouldn't outsmart me on that one. Diet rich in protein to calories. Some vegetables are higher in protein calorie than steak. I mean, that should make sense. If the cow makes steak out of grass, then the grass must have enough protein to concentrate to get to there. The exception, and I don't think I have that chart with me, the exception is calorie for calorie, broccoli is higher in protein than the steak. But remember, how many calories does broccoli have in it? Like a cup of broccoli, like 30 calories. It just happens that 45% of them come from protein. But still only gives you, what, half of that in protein, so 20 calories worth of protein. So don't get me wrong, you'd have to eat a whole bushel of broccoli to get your protein for every day. We're not gonna do that, but I'm just telling you that broccoli doesn't take second place to anything on your plate. The whole food, plant-based diet gives you 60 to 80 grams of protein a day. Guess what the RDA is for protein right now? For a male, it's 56 grams a day. For the ideal man who weighs 70 kilograms, et cetera, et cetera, et cetera. Ideal protein level for females is 44 grams a day. For the ideal female who's 120, I mean, they have to call it somewhere. So when they say the requirement here in a whole food plant-based diet, that's not a low protein diet. That is excessive, really. But plant-based, I'm not gonna worry about it. The daily requirement for adults is somewhere, and when we say requirement, we mean that if you're eating between 20 and 35 grams of protein a day, that would be adequate to keep you in health. So, some of us require more, some of us may work harder, some of us weigh more, some of us have a little more muscle, so we don't hold it right to this line from that standpoint. Rich in micronutrients, the lowly bean. Beans are amazing, and some populations do better on beans than. When I was in Costa Rica, guess what I get? I get beans and rice for breakfast. I get beans and rice for lunch. And top it off? No. And I enjoy it very much. When I come home, I probably eat a lot more salads than what I get down there. Okay, men and women who ate beans 4 times per week. Well, I was almost doing that in a day, but anyway. Look at this though. A 22% lower risk of coronary artery disease in those who consumed legumes. How many times a week? Once. Lower blood pressure, lower total cholesterol. Beans are a water-soluble fiber. They bind with the bile salts, the cholesterol, that come out of the liver, and then you can eliminate it. We're less likely to be diagnosed with high blood pressure or diabetes. Now here's a study, 9,600 Americans who did not have heart disease when the study began. Over an average of 19 years, about 1,800 cases were diagnosed. Now let's go on. Well, I guess I gotta finish that slide here. Here's how it broke down from that slide. So the point being is that eating a legume, a bean on a regular basis, is actually good for your protein, good for your disease risk, and good for the intestinal tract. So 2 points for Pintos. 7 steps to lower your blood fats. Triglyceride is just a fancy word for oil, or it's a fancy word for blood fat. So when the doctor says your triglyceride level is too high, you say, okay, doc, what's causing my triglycerides to go up? And he should hopefully give you a list, something like this, where you need to lose weight. Well, that doesn't take a whole lot of figuring out. Exercise, you burn triglycerides with your active muscles. So the more you exercise, the lower your triglyceride level. Eat less fat, you're putting less in. Stress is interesting. Stress increases the triglyceride level because under a stressful situation, your body will release more blood fats. And probably part of the correlation of why people under a lot of stress have more coronary artery disease. Stop smoking, almost don't need to suggest that one. Abstain from alcohol. Alcohol is a very high caloric food that gets converted into triglycerides. And sugar is almost a direct correlation. You take a diabetic, it's high blood sugar, you'll find high triglycerides almost back and forth. And the reason for it is that sugar that isn't used has to get converted into fat to go into storage. So it's a simple mathematic process. And I've already talked over my limit. Okay, we'll go a little longer, then I'll open up for questions. Garlic's effect on cholesterol. You may lose a few friends on this one, but hang in there with me. So serum cholesterol, they started the initial study, their cholesterol was 300. Their triglycerides was 170. Their bad cholesterol plus their good, plus the very low density was 83%, and their good guy was 17%. Well, let's not take too much time. At 8 months later, their cholesterol had dropped to 235. Their triglycerides had dropped to 120. Their ratios, the bad guy had dropped to 72, and the good guy had gone from 17 up to 28%.
How much garlic can we draw?
This garlic, I believe, I've got it from my memory here, it was 3 of the, not the whole ball, just the clove. So,
Raw. Eaten raw.
no, it didn't specify whether it was steamed or raw. The cholesterol lowering effect of this particular natural remedy could be either way. We didn't lose it by steaming it, from what I believe. How many recognize this? Well, that's what it looks like when it comes out of the ground. Oh, they washed those tubers. That's turmeric. And that probably has gotten more scientific studies, hundreds, if not thousands. We go around the world, we look at the various populations. If you go to the market in downtown San Jose in Costa Rica, they have probably 10 or 15 different colors of turmeric. That's obviously where it's grown. They go from orange, red, all the way to light orange, all the way over to pale, and going on and on. What is your color here? Anyway, this is the most typical one here, the orange, yellowish one. One of your best anti-inflammatories, when you go population studies, there's studies out of India that show a lot less dementia, so to me that's got to improve circulation to the brain. Some of you take it because you don't like your joints to hurt as much as they do, on and on. How about these? Anybody recognize these? Some of the best antioxidants available, and they actually taste good. Nuts reduce heart disease risk. This is Adventist study out of California, and the risk of a heart attack when they set the people who ate less than once a week, they ate nuts less than once a week, they set their risk of heart disease at 1. That's what we call relative risk. Now, if we ate nuts and our heart disease was above 1, that would tell us they're bad for us. If we eat more nuts, then and it keeps going down, then that's why you hear the statements that nuts happen to reduce coronary artery disease. So let's see how it works out. Let's see, non-fatal, so people survived that myocardial infarction, and these did not. For the non-fatal ones, by eating nut, okay, here we are, less than once a week, 1 to 4 times a week. Now, I don't know about for you, but this is not a hardship. I mean, you can eat nuts this is actually incredible. Reduce the risk from this group to this group about 25, 26%, and the fatal ones even a little more. On this group, eating nuts 5 or more times, we got a reduction in both groups, but we didn't get quite as much reduction in the fatal heart attack group as we did the non-fatal. And quite frankly, I wish I had a good explanation. This is just research. All the numbers don't work out exactly we like them to, so at least it tells me they're not just telling me stories, you know. Walnuts, handful a day can cut your cardiovascular event. We kind of went through as much as 51%. 2 tablespoons of peanut butter 5 times a week. Your kids will be glad to hear this one. Risk of diabetes by 20%. Along with tea, the easiest way to improve your health, reduce the progression of, I like that one, AMD. You got your macular situation, and you got your nutrients here, your different types of fats, you've got your different types of nuts, and skip the salt and added oil. So that you're back to your natural peanut butter. The ingredients say peanuts. Let's see. Okay, we'll conclude with this and let you ask me questions or whatever. Once again, this is the Adventist Health Study. This is the Adventist Health Study 2. Okay, Adventist Health Study 1 was what they did on just Californians. Adventist Health, and that was actually bring them in, test them, and do all that. Adventist Health Study 2 is a questionnaire. And some of you, did anybody in this room participate? Okay, I got 1, 2, okay. Basically, you felt like you were filling out your life history 3 times. I mean, these pages were 30 or 40 pages. It was extremely extensive. This is the result from that. Of course, you send it in, we have to assume they're telling the truth, et cetera, et cetera. So the diabetes prevalence as percent of that group, in these various groups that qualified for vegan, lacto-ovo, pesco, semi, we're getting too many vegetarians here. And I mean, this is, people eat fish, these people that, they go, well, halfway or whatever, and then the SAD, the standard American diet. But in this group, from this study of 60,000 participants, I just want to show you where the plant-based people fell. And everything we do above that, in other words, the more animal protein you put in your regime, the higher the percentage of diabetes keeps coming out. So, I gotta make a conclusion here. I guess it's getting very obvious, but the conclusion is that the more animal protein you consume, you shorten your lifespan, you're gonna spend too much time in the hospital, and I'm not convinced that eating vegetarian is so terrible and so bad that you can't stand it. I'm convinced that we have a lot of good, healthy food to consume, and I just need sometimes to change my taste buds. I will also admit that I'm very biased. I was one of those kids that was raised on cabbage. So I married a lady who wasn't, and we'd walk through the neighborhood in Southern California, and she would smell the barbecue. Or somebody cooking out, and she'd say something like to me, boy, doesn't that smell good? And guess what I had to say? Smells like burnt flesh to me. But see, I wasn't emotionally connected. That didn't mean family good times. That doesn't mean all the barbecue sauce. It meant zip to me. So I just want to let you know my bias, okay? So I may have it a little easier than some of you as far as changing some health habits. At the same time, to me, the overwhelming evidence and what I put my whole career into is exactly what I'm telling you. So when people would come to the office, we present the data, we make it personalized for them, and I don't know how many heart attacks the Lord blessed me to save, but they're definitely numerous, and so you feel like, hey, my work has been worthwhile. It's been good. So let's open up for questions. Yes, sir.
What are plant-based sources of vitamin B12? Because oftentimes, you hear about the plant-based diet. The concern is where are you going to get the B12 from?
That's the third question you get when you're a vegetarian. Where do you get your protein? Where do you get your calcium? Where do you get your B12? Here's what we find out in the real world. There's more B12 deficiencies in the meat-eating population than the vegetarians. So we started looking, okay, what's going on here? Because I'm not aware of consuming any B12. I mean, if you ride a motorcycle, you consume B12, and you know exactly what I mean. Don't smile while you're riding, So we can get minute amounts. B12 is made by bacteria. It's not made by a cow. It's not made by a pig. It's not made by fish. B12 is only made by bacteria. So the first thing I had to admit is that B12 is automatically contamination. You don't get B12 in cow's milk unless it's contaminated with bacteria. So what we do, we take the cow, we get a long needle on a syringe, we pull milk out of the udder, or above the udder, we find basically no B12. They call it trace. We let it go through the proper canal, into the bucket, into the vat, into the truck, and on your table. And if it didn't have any bacteria, you need to refrigerate it. You don't refrigerate your milk for a week, and what do you have? That's bacteria, even after it's been pasteurized. So that's the first point. B12 only comes from bacteria. The second point is you make a lot of B12 in your mouth. You have the right species and the right type of bacteria in all our mouths. The other place you make bacteria in your body is your large intestine makes a load of it. So we can gesture a little bit. How much you're getting in the bowel, how much you're getting from your own mouth, how much do you actually need? Now, here's how the whole thing starts fitting together. Number one, the lower the protein, less B12 you need. The higher the protein in the diet, the more B12 you need. So you get by really well with 3 milligrams. 3 milligrams. No, I got to drop back. I'm too high. 3 micrograms of B12 a day is what we consider your standard. So you got some people take 1,000. I'm going, that's enough for a whole year. The problem is, you know where most of it goes. So the B12 controversy will keep going on, but the best evidence I have right now is you make it in your mouth, you make it in your large bowel. There is a possibility where you get some, I'm glad we've had lunch already. You get some regurgitation from the large intestine through the ileocecal valve, and you pick it up in your distal ileum. That is where you absorb your B12. So if a person's had surgery, what do I say? Your B12 can be absorbed only in the lower part of the small intestine. That's where you absorb it. Drinks, cereals, if you went home and read all your labels and you eat a dry cereal, you're getting B12. If you take any kind of supplements, you're going to B12. I just don't find B12 deficiencies as prevalent in my vegans as I do in my meat eating groups. It doesn't mean that they don't exist in both groups. I'm saying it's an absorption issue. When you start studying people well, you find absorption problems, not quantity taking in problems. But you don't ignore it. If you have B12 symptoms, we definitely test. But in my testing, I'm not finding it.
Ask
That's
about
a long
cinema.
answer. Yes, Dan.
Cinema.
You drink too much water.
Can you drink too much water? Yes, you can. In this kind of weather, though,
Ask about cinema.
too much. If you're drinking 3 gallons a day right now, I would say that can be too much. On the other hand, if you're drinking a gallon a day right now, and if you're sweating like I do those days, I don't think that's too much. The basic thing is, you don't want to dilute your electrolytes to the point where you cause the problem you're trying to prevent and keep yourself hydrated. On the other hand, we've got a lot of people that are drinking all these electrolyte drinks, or doing all this stuff. And when you take them to the hospital, they say, oh, I must be low in sodium, I had a heat stroke. Well, just run their blood test, and what do you find?
Yeah.
They're dehydrated. If you had drunk your water. Now, a marathon runner, possibly. We go out and run 5 miles? No. We just don't find it. It's water is the big problem. Yeah.
Is cinnamon a good help to the body?
That's a double-edged sword there. Cinnamon can be a gastric irritant. In other words, irritate your mucosal lining. So that's the negative side. The research has come out, and I haven't been able to prove it. Doesn't mean that I've got all the patience in the world. But I haven't found cinnamon to be effective in decreasing blood sugar levels significantly to help with my diabetics. I just don't find it to be true. It's not working out. Now, the research sometimes will do quantities that are so outrageous that I'm going, no one's going to take a quarter cup of cinnamon a day. So I don't know if I'm not giving my patients enough, or if it's not effective for every patient, or if I'm already doing much a better job than what cinnamon can do. Because by the time you change your diet and you walk for 2 miles a day, I think cinnamon probably can't compete with a lifestyle. Maybe that's probably the major issue.
Good question.
John.
A quick thought. You mentioned earlier that rabbits, that's right, rabbits have a similar digestive system, and the system does. When they put rabbits on a high-fat diet in a lab, in this one lab, they found that when they killed the rabbits, the ones on a high-fat diet had a lot of blockage. The ones in the lower cages, they couldn't figure out why they had so little blockage in their arteries. The people that cleaned the cages took the ones out of the bottom and petted them and loved them, and had the exact same. So the point being that love actually helps your health.
Excellent point.
And one other thought, Nathan Kripken was on a low protein diet. He actually committed suicide.
No, I didn't get that. What was
Yeah,
that?
he did. And the other thing too, you just.
No, I didn't
Repeat, he didn't get what you
I
said.
didn't
Can you
hear what
repeat
you-
about suicide?
Kripken actually committed suicide. He did, look it up.
Oh, I know he did. He had acute lead poisoning.
He what? I'm sorry.
He shot himself.
Right, yeah.
But
I'm
let me
only
have
kidding, I
some-
said he was on
Let me
both
tell you
those.
something about that man, since we're in this group. That man came to Loma Linda when I was there.
The other thing you mentioned, and they mentioned it too, with the second best protein was peanut, and you mentioned aflatoxins. I mean, I stopped protein, I stopped peanut butter. I mean, all the organic, they all have the mold, all of it. So is it a good source of protein?
It's a good source of protein if it's a good source of food. If it has aflatoxins in it, then I would be concerned. Anyway, back to Pritikin, this short story. Pritikin came to Loma Linda and was lecturing to us health folks. Told us about his research, how he had reversed his own heart disease, et cetera, et cetera. And then he made a few statements, and some of you will understand this. He goes, you know, I've read your little red books, and those little red books are things like counsels on diets and foods, counsels on health, et cetera, et cetera. But then the next statement he made just sealed it for me. He said, but I don't believe in your God. So when Nathan Pritikin, the man who had reversed his own coronary artery disease, by the way, he was an engineer, he went to medical law, got cancer. He went and shot himself in the head. Had nothing to do with reversing heart disease, but it had to do with exactly the other point he brought up, the rabbits that got pet, the rabbits that got, there's more components in this whole situation. So when they direct you to the chart, if you can't see low enough, we should probably put that one on the top, and you see the bottom one. Trust in God. Goes far beyond everything I've said here. At the same time, I also believe that we both have a personal responsibility to make the best decisions we can to take care of this body temple. It's
One
it's
last
a
thought,
God-given
last thought.
gift. When you-
Doesn't tempeh have B12?
Champagne,
Tempeh.
if it's a fermented, if it's got bacteria, sorry.
Champagne.
If it's got bacteria in it,
Right.
the answer is yes, but it has nothing to do with the soy. It's contaminated with bacteria.
Okay.
Just remember that fact. If it's got B12, it's made from a bacteria. It's that simple. It's not made.
So the point being that you can get B12 from plant foods, because it comes from soy.
If it's rotted, yeah.
Right.
Just a statement, it's amazing how God put us in a garden before we was in a farm.
Good point, Bill.
Man.
Dan.
If you don't want to eat the raw garlic, Hope for Health has a product, odorless garlic, that we sell.
What is?
Diane.
You say
Just a plug.
something like tempeh is actually harmful, that we shouldn't eat it?
I'm saying right now, I'm seeing a whole shift in fermented soy foods. And they claim that the success in the Japanese population in their soy intake has been due to fermented foods. I happen to disagree with them. Because fermented foods, whenever you ferment the food and you change the chemistry of the protein and the chemistry of the fats, you have changed something that outweighs the possible health benefits.
But
And
I've
they-
heard fermentation is good for you.
Oh, I understand. I can show you slides that tell you that beer is good for you. I'm gonna go, no.
Sauerkraut is supposed to be very good for you.
But sauerkraut is not a fermented product after you get it. If you bought it in a can and it was a fermented product, it'd blow up on the shelf. So most sauerkraut that people eat is so sterilized, they had to kill any bacteria that's in it. So the only thing you got is cabbage and dead bacteria.
So if we ferment our own,
If you fermented your own, that's what I'm talking about. I'm against fermentation. Fermentation leads to a change in the chemistry of the fat and the chemistry of the protein in there. That's not healthy. It's more inflammatory to your vessels. You see, God made things stink for a reason. So that you would go, wow, that's terrible. I mean, I don't know if you ever had Limburger cheese, but I mean, hopefully that would cure anybody. The point is, you see how these fads come along. And right now, we're telling you that your intestines are so bad that you have to eat all this probiotics to get stuff back that you should have never messed up in the first place. So think twice, think 3 times, think 4 times before you ever take an antibiotic. Because we have handed out antibiotics for the past 40 years, and we have wrecked more intestinal tracts than what I would like to admit. The point being is that the best person that benefits from an antibiotic is a person who never uses it except almost in a life and death situation, and they seem to respond because those bugs aren't educated yet. And I watch I'm working in pediatrics. I watch children go through probably sometimes 4 to 6 episodes during the winter dealing with their otitis media, their middle ear infection, antibiotic. I'm going, folks, please stop smoking at home. Don't give the kids sugar and donuts on the way home. And allow the immune system to start to respond. So I'm a lifestyle specialist, and they plan to me and then stop it becoming. But you have to ask for the evidence, and that's what they're not giving. And fermented foods can only be fermented if they are still live and raw. So the example would be sauerkraut may have been fermented in the process of making it, but when it's on the shelf in a can, that's not fermenting. Yogurt would be different. If you leave yogurt out, what happens to it? The bacteria will continue to grow and take over. So any product that if you don't refrigerate it, it goes really bad. That you got live culture, they call it. But why don't we take one step back? Why don't we take care of our intestinal tract so we don't need to do this? And now they've really got my goat. They want to sell you prebiotics to help your probiotics to help something you messed up in the first place. I'm like, what's a prebiotic? Have you guys ever heard of oatmeal? Save your money. So there's a lot of fads that I smile at. And it's like cholesterol 30 years ago. Cornflakes, cholesterol free. Well, corn never had cholesterol to start with. Now what's the fad now? Gluten free. They got gluten free on pinto beef. I mean, you go, folks, it's the top. You will see they are marketing, quote, health words to people who are not informed.
And now they're saying oatmeal is bad for you.
I'll reserve my comment. Lois.
Yeah, so you're saying from the studies that actually animal protein is more causative of diabetes than sugar would be?
That would be a good comparison. From the evidence here, overall, yes. Creating insulin resistance is probably more effectively done with a high animal protein diet. I saw a hand. Karen.
Too far.
You hear a lot about lectins being harmful now. Could you speak on that?
Oh, you're talking to Dr. Grundy, and he and I just have a basic philosophy disagreement. Yeah. He is so geared in on trying to reduce inflammation, his program causes cancer. He is so geared in on trying to deal with this area here that he messes up. One lecture that just tipped me over the edge is he basically said, what I'm trying to do is find creative ways for people to drink olive oil. I'm serious. I'm quoting almost verbatim. I'm saying, I'm sorry, sir. You may believe that's anti-inflammatory, but if you've ever heard of turmeric, you may give people a better shot. So, Dr. Grundy, and I know he's from Loma Linda, but we have difficulties in reading the data. Jen.
I just want to make a comment to, in regards to people who, when approached with a vegetarian diet, it doesn't taste good. Well, there are ways to make it taste good. It's also a willingness to re-educate your taste buds.
Agreed. And I'm going to put in an advertisement. If you come to Burnsville Church, Seventh Adventist Church, they have a good meal there, and you're going to be able to taste some of the excellent choices for vegetarian.
Nice.
Have we done it? Any more questions? Observations?
Good job. Thank you.
Thank you. Well,
ladies and
here's
gentlemen,
the host.
please help me once again thank Dr. Collins for coming. Now, we have a special prize, and we're going to give it to our grand prize winner, Miss Elizabeth over here. Miss Elizabeth, we have a special This is a cookbook detailing the 4 healthiest groups in the world. I hope you enjoy that. And I have your number. I'll be texting you and giving you a call, and you and I can catch up sometime, okay? You let me know how you like it, all right? Now, we're going to, did everybody get a gift bag who wanted one? We're going to look at our gift bag a little bit. In our gift bag, you have some handy pencil and note paper. You have some magazines to look at. But we want to highlight 2 things in our gift bag. We want to highlight an event that's happening, the Science Mansion. It's happening in a month's time. That's happening over in Asheville. That's a free tour of the sanctuary, the Mosaic Sanctuary of Exodus. But more importantly, we have a special chef coming to visit us at Burnsville Seventh-day Adventist Church. Mark Anthony, he is a renowned chef. He's worked in Vegas, he's worked many places, and he's coming to give us a special demonstration. So look at your flyer, RSVP if you want to come.
Bring a friend.
Bring a friend. If you need more flyers to share or pass out, you see that gentleman, Mr. Orain, right over there. Hi, Orain. All right. He does painting, food sculptures. It's really quite fascinating, so you don't want to miss that. All right. Now is the time that a lot of us have been waiting for. It's time for our booths. It's time for us to take part and visit we have 6 booths. We have station 1 is vital signs. Station 2, you can have a glucose test done. Station 3, over by Orain, peak flow meter. Station 4, height and weight with BMI. Station 5, health counseling by Dr. Richard Solber and pharmacist Natasha Brown. And station number 6, which is in the next room, through this one past the kitchen where all the nice comfy chairs and the fireplace are, we have mental and spiritual counseling by Pastor Artem Demetria. So please give us about 5 minutes for setup time for our volunteers to get in position. During that 5 minutes, you're welcome to use one of our 2 restrooms. We have it all the way again through the kitchen. Past the spiritual counseling, we have a restroom over here, and we have a restroom right here on the corner. So please, you guys have been sitting well, get up, stretch your legs, have a drink of water. In 5 minutes, our booth will open. Thank you so much.
Number 6.
I think I should leave my rabbit this morning. But